What's going on, everyone? Today we're going to be covering the topic of injuries. How long do you need to take time off before you hit the gym again? Now, before we get into these injury topics, first, I think it's important to note out that what injury are you going through, right? What type of injury are you having? And I think this topic is really interesting because when you're working with certain clients and the times that I've worked with certain clients, and injuries are one of those things where you can train as much as you want to avoid injuries, but they're gonna happen some way somehow. And they're not always extreme. Sometimes they're minor things that might be bothering us, but they're always gonna arise, right? They're always gonna be part of the picture some way, somehow. The point is to do our best to prepare ourselves to avoid these injuries. By avoid, I mean you can't avoid them if they happen, but train in a way where you can be better suited and better prepared to do things. So, my breakdown today is going to be basically on tendons, ligaments, and muscles. So, the difference between all three and why they have different timelines. So, first, let's talk about this. So, I think there's a difference demand in terms of stress when you're thinking about what part got injured, right? So if I'm thinking about a very common injury, and that would be like lower back pain, you have to think, what is it that your lower back is suffering from? Lower back pain is one of the interesting ones because there's not much that you can do that you won't feel like it's being affected, right? So like, for example, if you're gonna go touch your toes, you're gonna feel discomfort. If you anything that has to be inflection or extension, you're gonna feel some sort of discomfort. So from seeing it that way, you know that a lot of movements are gonna be bothering you. First, I would say avoid anything that bothers you, right? You can be very proactive, do a lot of things to avoid that. And with back pain, I would say it's tricky because you don't know if it's a vertebrae issue, is it a nerve issue, or is it a muscular issue. So there, and this kind of entails to a lot of things, but more back. And I think the back is so that much more intricate and sensitive because there's a lot of little things that you can't really test for, right? So when you're talking about back pain and the times I've dealt with clients with back pain, I always think, well, is it a herniation? What is it that needs to be entailed here? So if you're working with a physical therapist, they're going to do different types of tests. Well, one of the tests being myotone type of testing. Another type of testing is sensory testing. So see if maybe you have, if you're sensitive, for example, if let's say I hurt my shoulder and someone was to touch me in this area or, you know, bend my fingers in a certain way and that bothers me, right? So typically what they talk about is like nerve gliding and how your nerves are being stretched and that bothers you, then that's typically more of a nerve issue. Nerves can take a little bit longer to heal, right? And I'll talk about that. I don't want to get too ahead of myself. So muscle injuries, right? So when we're thinking about muscles are typically 2 to 8 weeks in terms of your recovery. What things can you do for repairment? It depends what area you injured. A lot of times, and I'm talking about this is more drastic. I've seen people tear their pec, and which is very unfortunate. It really does suck. For situations where you tear the muscle off the bone, it requires immediate surgery. And a lot of times, I've even seen people tear their pec muscle and never repair it. Does that mean that won't be able to train anymore? Yeah, you can still train. A lot of people have torn biceps and they still train. They're still very active. But does that mean that they're probably functioning at 100%? Probably not. They're doing a lot of exercises. They're accommodating their injury, but it's not something that you can really do from a training perspective. You just kind of have to let it heal, and then heal after surgery. So tearing a muscle off the bone, for sure, you're out, right? You're out in that sense that there's not much you can do. Now, if we start thinking about injuries like maybe you bruise an area, and that's typically more of a muscle pull, muscle strain. For those injuries, You typically have to take 2 weeks off and a little bit longer, 4 to 6 weeks. It just depends on how you heal, how the muscle heals. Um, I would say that pulling a muscle is probably the best injury that you can have. Um, and I say that with air quotes because the reason I say that is because muscles have a lot of vascularity. They have a lot of blood support, meaning that that muscle can heal with time, right? But if you think about things that are not muscle related, it can be a little bit different. So that brings me back to tendons. Think about the tendon, right? So you have, if for example, if we're talking about the bicep here, right? So if we're talking about the bicep, we have the bicep and we have the end of the bicep. That what connects my bicep to my elbow and what connects my bicep to my shoulder is the tendons. So I like to think about it like this. You have the tendon, you have the muscle, and then you have another tendon. So the muscle always lives in the middle. So you have tendons all over your body. You have muscles all over your body. The tendons typically take a little bit longer because maybe they have more stress in the point that your movements are going to always be involved, right? Even walking, you're swinging your arm. If you were to hurt your bicep, it takes a little bit longer. And with tendons, typically, what I've seen and what I those the type of recoveries that we're talking about is things that you can do to be proactive. So people talk about different approaches and things that they like to do. I personally love dry needling. If you don't know what dry needling is, it's very different from acupuncture. Acupuncture just gets to the subcutaneous skin, so it just only gets to the top layer, right? And it's really good if you like that kind of stuff. I think it could be very proactive, but a better situation would be dry needling. Dry needling is when you get these needles and you go to the muscle belly and you're able to poke at that muscle belly. And the reason why you do this is because you create inflammation. Inflammation brings more blood flow, brings more white blood cells, and allows that area to cause healing. So this is really important when you're thinking about what you can do to recover faster. This is something I always recommend because A is not as is more cost effective than it would be getting something like a PRP shot. And if you don't know what a PRP shot is, a plasma rich platelets. So basically, what you do is you extract blood, and that blood has rich oxygen. It's rich oxygen blood, and then you get that blood back into your body. So you do PRP, or you can do things like cortisone shots. But cortisone shots are a little bit different because it is a steroid, and not steroid in the sense of an anabolic steroid like Test or Deca or that kind of stuff. It's more of a steroid that is going to allow you to again, same kind of concept, allow that area to have some inflammation so you can heal over time. And you'll see the pain receptors be maybe a little bit more receptive to that. But it can be, again, it can be very expensive. So it's PRP. PRP is super expensive. So you have to understand what you are capable of doing. I would say with injuries like muscle injuries and tendon injuries, you have to listen to your body. You have to listen to how movements are affecting you. For example, a lot of people do this. They get injured and they stop training that specific area. In my opinion, you should be doing the reverse. If you get injured, if you pulled your hamstring, for example, you should, of course, stop, allow your body to rest. If the area is too sensitive, you got to give yourself some time off. But one way you can start implementing it, and this is one of the ways that a lot of physical therapists like to approach this, it's by working that tissue back to understanding the speeds of contractions. So my favorite way to apply this is by doing isometrics. Isometrics means I'm holding a position, but there's no movement, right? There's a contraction, but there's no movement. And then you start going into a little bit more of dynamic work. So maybe you pull your hamstrings. I'm going to hold a hip bridge, and I'm just going to hold it with both feet so I don't have that much tension on that leg that I got injured. Little by little, maybe I can go single leg. From there, I start adding some more movement, and I'm maybe going up and down now. the last progression, we're doing plyometrics. So now we're doing faster contractions, faster reactions, and more force on the eccentric. Eccentric meaning this is where you receive more load, right? So think isometrics, right? Regular contractions, or faster contractions, and eventually into your plyometrics. And those plyometrics can lead to eventually running, which running and jumping is part of your plyometric program. Sprinting being the maximal way to express yourself in terms of movement. Now, ligaments. When we think ligaments, this is the part, right? And I say ligaments, maybe some cartilage as well. Ligaments take forever to heal. Okay, and the reason why is because you have to think about ligaments. You have ligaments in every joint. You have ligaments in your fingers, everywhere, right? But ligaments, the problem with ligaments is that they don't have as much vascularity, so they don't have so much blood supply to allow themselves to repair faster, right? And a lot of times you have to think about ligaments almost being like a bolt, right? So if that bolt ends up becoming rusted, you can't do much about it being rusted. If that bolt breaks, you need to repair it. So a lot of people that have injuries like ACLs and stuff like that, they can do a lot of movements. They can do a lot of stuff that brings them back to play, brings them back to lifting in the weight room. But maybe you will have some compensation. Compensation meaning that you might have some movements that might bother you. So you have to work around it. One of the common ones, and it doesn't fall under so much ligaments, but I would say is more like cartilage, right? So a very common one is meniscus tears. Meniscus tears are again something that could take longer to heal. So you got to let your body just slowly progress. And you know, with injuries, I always say you have to get to know your body more than just when it feels good. You have to understand your body when it also feels funky, right? When it feels not so good, when you don't feel as powerful, you don't feel as fast, you don't feel as strong. It's important to listen to your body. What's your body asking you to do? Is your body asking you to do some stretches? Is it appropriate to do some stretches at that time, right? One of the common mistakes that people do is that they get an injury, like they pulled their hamstring, or they pulled their back, and they immediately go into stretching. You would think that's a good thing, but no, it isn't, because you have to think the reason that muscle got bothered in the first place is because it got pulled, or it got used, pushed or pulled, right? All muscles pull to a position where you overdid something. It over exceeded the strength at that muscle that it needed at that time. So it's not important to pull any longer on something that's already injured, right? That's like almost pulling on a rope when the rope has a little bit of threads left. It's not smart to pull it, right? And a lot of people get hurt and they start stretching right away, thinking that they can heal faster. In contrast, that's not the right thing to do, because you're almost exaggerating that injury even further. So you have to be mindful of that. So, what really delays the injury is a lot of stuff, right? So is number one, not being active enough, just leaving your injuries be, right? I would say yes, take your time, allow your body to heal up, but then start introducing the training. Introduce the training that's going to allow you to super exceed and get back to feeling better. So, and a lot of times people have timelines, right? So it depends if you got injured and maybe you got injured and you're going to go do a race, or you got injured and you're going to go on a trip. And you have to think about, what is my pros and cons? Can I speed up my recovery process, and how so? A lot of people like to do apply ice, and I know ice is one of those topics where people love doing ice baths and stuff like that. But for an injury, it might not be important to do ice. I always recommend heat. And the reason why you say heat is because heat allows, again, more blood flow circulation. And that's what you want to do. You want vasodilation. What does heat do? I mean, ice do. It vasoconstricts. So it constricts blood flow to that area. A good way to implement both is to do contrast, meaning you do ice bath and then you do a sauna, for example, right? Or you apply heat to that area. So now you're getting the benefits of both, right? In that sense, I can see how that can promote some recovery. And also your lymphatic system, you have lymph nodes that allow that recovery to happen by allowing white blood cells to come to the area. So there's a lot of stuff that we can do on that. Now, you have to be really smart to dissociate whether this is pain or this is discomfort. Discomfort would be it's tolerable. It feels like you are working, but it doesn't feel like you can do it at faster speeds, right? Because it feels like you might injure it again. And it's almost better to have that mindset to think I can do a little bit, right? A little bit at a time, opposed to thinking, no, I'm injured, I'm hurt, I can't do anything. Because then you're delaying it, right? You can be taking another step into recovering and coming back to your full potential, but you stop because now you're thinking, oh no, I'm injured, I need to stop completely. And that's not the case, right? Things that you can be possibly taking is, ibuprofen to help with feeling a little bit of relief. But those are not things that you want to be more dependent on, because again, the point is to recover. The point is not to be hooked on just the recovery process, is allowing us to get back to where we need to be. So we have to think about that. From a psychological standpoint, I think it's really important to note out that we think of injuries not as things that hinder us, but as lessons, right? So I think even with the athletes that I'm working with, I always tell them these injuries are your way of understanding what's happening to your body and makes you almost more in tune with yourself. Me speaking out of experience, I've had surgeries, I've broken bones, I've broken ligaments, I've done all of that. And I think the blessing that I got from my injuries is that I was able to do it so early on and get them out of the way in that sense so early when I was a lot younger. And I didn't have the physical therapy that I should have been having. And I think that also caused me to fall in love with what training was, is how to get back to being who I needed to be, right? Just an athlete playing sports, playing multiple sports. But it's understanding how to come back and understanding the process, that what that is. A lot of people talk about the process. The process is really the journey to getting back. And in order for you to appreciate your body from a movement standpoint, later you have to also understand the injuries that you had. It almost allows you to warm up better, right? So now you're doing your warm-ups, you're going to go for a run, you're going to go hike, you're going to go do whatever, you're going to go play pickle, paddle, whatever. But now you have an understanding of how your body operates. This is what I need to do in order for me to be pain-free. And this is the best approach that you can approach your body with, because you have to understand there's different ways that you can come back to play, but it's all about understanding what your body needs at the right time. It's important that we understand this, because as human beings, it's easy to say, this is my motor. I'm going to let my motor go super fast, but not understanding going super fast is what's going to allow me to get injured. So in order for us to pick up the speed, think about 10 miles an hour is better than no miles an hour, right? So slower is always better in that sense. So some closing thoughts. I want to say that recovery, isn't always about time. It's about doing the right things at the right time. So allowing your body to recover is really not just an approach of how you're going to heal, but how you approach your healing. And the healing process is very psychological as well, because if you're frustrated with this, it's going to even take longer. You have to listen to your body. The clients that I work with and the athletes I've worked with that have had injuries, everyone has those little small tweaks that happen. I always encourage understanding what the long-term goal is, right? And doing exercises and doing things that we can do to be proactive to allow that recovery to happen. Things like foam rolling, all that stuff is really good, but sometimes doing a little bit more can put us in a position that we can further get along. And that's the point. The point is to eventually get to a point where we feel like we're getting better, we're getting stronger, and we can feel like we're very proud of ourselves in that sense, that we can get to a place where we're mechanically and psychologically sound, right? So bridging those two gaps. Guys, thank you for tuning in today. I think this topic can get really into detail, but there's going to be things that I'll pop up and have different points on. But today I just really wanted to cover those three things: ligaments, tendons, and muscle, and how they different in terms of your body recover, how your body recovers, and the timeline. And, sometimes it takes a little bit longer. Sometimes you did everything you needed to do prior to allow yourself to get back into speed. Before I go, I do want to note out that the clients that I have seen recover faster, and especially what clients are going into surgery, it's the clients that are, or the clients or athletes that are being proactive before. So they're doing a lot of exercises to prepare themselves for surgery. After surgery, they've already been in shape, and there's other things that you can do. You can, if you hurt your right ankle, you can train the three limbs that you have. You can still be very proactive in that sense, but you just don't have to go as hard as you needed, as you could go in the past. It's about slow and progressive progress, and that's what we want. Thank you guys for tuning in.